Welcome to Needham School Spotlight. I'm Dan Goodykant, Superintendent of Schools, sitting behind this mask. I'm here at Needham High School, joined by some of my colleagues as we continue to plan for programming for students, not just at Needham High School, but throughout the district. Thanks to Barbara Singer, our Director of Health Services, for being here, Aaron Seacott, High School Principal, and Dan Lee, our High School Athletics Director. I thought it'd be really important this morning to share with the community how our health and safety protocols and everything regarding health is going in our schools, Barbara, particularly at the high school, but throughout the district. And then maybe Aaron and Dan talk about what's happening with co-curricular activities, particularly athletics, and what that may look like as we approach the winter season in the middle of this health crisis and pandemic. So first of all, Barbara, how are things going?
Well, I'd like to start by saying, first of all, thank you for having me, but here we are, December 15th, and we're still in the buildings. This has been, so I think we're doing quite well. This has really been a community effort. I get to go to all of the buildings in the district on a frequent basis, and I've been really pleased with what I've seen. The students are doing really well with wearing masks and following the safety precautions. Staff and teachers are doing great work with following all of the safety and health protocols that we put into place. Nurses are doing amazing work with illness surveillance and case management and assisting our great public health department with contact tracing. And so all around, I think things have been doing really well. I also really want to thank families and thank the families who have been doing a really good job of following their students' health every day, keeping students home when they've been sick, communicating with nurses around health issues and providing COVID test results, following our illness guidelines, and curtailing any travel plans that might be into play, which I know isn't easy, because there is a travel order in Massachusetts. This really is a collective effort on all of our parts, and that's what I think is keeping our students, our staff healthy, and our schools open.
Well, thank you for that overview. You mentioned a few things I want to pick up on. But one thing you said is true. Throughout the district, pre-K through 12, students and staff, but particularly our students, have been great about mask wearing, hygiene. Physical distancing is a little bit of a challenge, yeah. I think probably particularly at the high school level, but students have really risen to the occasion with the support of their families and the staff. So that really has allowed for us to, I think, in many ways, remain in school. Mm-hmm. Aaron, how are things going at the high school from what you see so far?
I really want to echo what Barbara said. We've been thoroughly impressed by everybody coming into the building. The students in particular, exceptionally compliant, really, frankly, appreciative to have the opportunity to be in the building. And I think that sense of appreciation has translated into their willingness to go through all these new measures that we have to follow this year. There have been very few incidents in the entire year where I've had to address non-compliance in any way. And even in those times, it's almost always, oh my gosh, I'm so sorry, and fix a mask or something of that nature. Almost nothing that's intentional. So the kids are just great. And as Barbara said, it's supported, their behavior is really supported by the adults. Teachers are outstanding about shifting their instruction. Teaching looks different. The learning may be the same, but the teaching looks different in the classroom. You mentioned the distancing. Each of the desks are spaced apart in each of the classrooms. There's much less movement and direct interaction physically within a space. Teachers are recreating that virtually in another means. Building in mask breaks throughout the day to give us all a break outside in very careful and distanced ways once we get outside. And even in the lunchroom. At the start of the year, we thought, as we were looking at this sea of desks, wow, that doesn't look good. And yet, kids have adapted, really, in ways that I think the adults didn't give them enough credit for at the start. There are social conversations, they're interacting, they're able to have the same sort of interactions that they had, just a little bit more distanced. And I think the one thing that I'll add in terms of the cafeteria, an unexpected benefit, is the caf at the high school is a big space, as all of you know. And for a student who's a little bit less socially comfortable, walking into that space can be really difficult. And even sitting down and potentially sitting at a big table by yourself can be very uncomfortable.
Sure.
Given that everybody is at their own desk and at the same spacing and in the same situation, it actually has created a lot less anxiety for a decent portion of our students who
It's
are
like a
now
level
coming into
playing
the space.
field, if
Absolutely.
you will, for everyone.
It's
Yeah.
not highlighting how they're feeling in a distinct way. It's allowing them to settle in with everybody else. So, from all of the really thoughtful work that we put in place, that's clearly working, to some of these unintended consequences and really just the resilience and the adaptability of the students. We've been so impressed. And then the last thing I'll reiterate that Barbara touched on is the families. This wouldn't work if families weren't making really careful, sometimes uncomfortable decisions within their own homes of saying no to their kids, not allowing things to happen, not planning some of the family events they typically do or the family trips. If those things weren't happening, this would fall apart. And if more families were thinking, hey, we're close to this vaccine, we can start to make some of those decisions, this still will fall apart. So we need to make sure that all the way around, the families, the students, and the staff continue to do everything they've done to make this successful.
Now, we know, and it's true, that cases are rising as we sit here this morning throughout the Commonwealth and throughout the nation. And there certainly have been, as the school year has gone on, an increased number of cases in the Needham Public Schools, mostly at the secondary level.
Mm-hmm.
And I'm just wondering how they're not connected. As far as we know, we've had no in-school transmission. They've been isolated pieces here and there. How are students and staff reacting to those cases, Aaron? I know it does make some people feel a little anxious.
Yeah, I think when you're looking at pure numbers, there's a degree of anxiety that's understandable. And I think the context is really important. First and foremost, most cases where a student is positive, the student doesn't even come into the building when they're infectious. The family, again, is making the right choice by keeping them home. The first sign of illness, they might think it's the beginning of a typical fall cold, and they're keeping their child home. And then if it does develop into COVID symptoms, more COVID symptoms, and ultimately a positive test, the child will have been already maintained at home and not interacting with others. That's huge, honestly, for us. And then the precautions that we have in place, I mean, here we are demonstrating a few of them where there are masks and our distance. Just steps like this limit the likelihood, the scientific likelihood of spread considerably. And as both of you have noted, we haven't had any cases of internal transmission, which continues to highlight that what we're doing within the building keeps us safe. So the family's decisions not to have us even interact with positive students, and then in the rare cases where they find out they're positive after they've been in, our precautions have been really effective in making sure that there's no spread once they've been in the building. So yeah, I understand the concern around rising cases, and I'll just keep coming back to, we've got this little pocket of safety here, and it's tenuous, and it relies on everybody doing the right thing constantly on a daily basis. But right now, and throughout this fall, it's really been working well to protect us from some of the outside numbers and concerns.
You also have in every school a health and safety committee that's helping advise and guide and discuss on a weekly basis, or almost a weekly basis, of how things are being, protocols are being followed in the school. So I think that's probably helpful. Barbara, cases are going up, and what do you see through a district level with that?
Well, as you said, cases are going up in not only Needham, but Massachusetts and around the country. So that has trickled into the schools. But as you both have said, the good news is there has not been in-school transmission, which again means that the safety protocols that we have in place is working. I think it's a really good reminder that we all need to follow the 3 W's, whether we're inside the building or outside the building, because what we all do outside of school can have an impact inside of school. So we always say go with the 3 W's, wear a mask, wash your hands, watch your distance. The transmission has really been around household contacts and small group gatherings and small pockets of friends. So another reminder is just even if you're with the same 3 or 4 friends that you think are in their bubble, your 3 or 4 friends also may have a bubble, and the bubbles trickle to other bubbles, and that's how the transmission spreads. So again, we want to, we're all social beings, and that is a need, but again, it's just remaining really vigilant about wearing your mask, watching your distance, avoiding large gatherings, curtailing travel. And I also want to recognize our community partners, our public health department, Dr. Stern. We in Needham are so lucky to have the public health department that we have.
Oh, we absolutely are.
Yeah, the school nurses and the public health nurses are talking on a daily basis, sometimes many times a day. We have the school nurses and public health nurses have a seamless communication system around contact tracing, so that when we have had to help with contact tracing in the schools, it's really been pretty efficient because we just have a really smooth partnership. So I'm really grateful.
We're fortunate to have not only public health partners, but public safety partners in the town of Needham, police chief, fire chief, all of these, our town manager, everybody working together really to support our students and staff. So Dan, I want to turn to you now because we're hearing that cases are growing. We're also hearing that Needham High School and the Needham Public Schools have been able to manage a safe environment so far for our students. And now we're talking about a winter season of providing much needed outlet for students to be engaged, in this case in athletics. I want Aaron to think about, there's some other co-curricular activities going on as well. We'll get to those in a moment. But so Dan, as you hear from Barbara and Aaron about how there are cases growing, how do we, first of all, what are we going to do regarding winter athletics, and how can we do it safely?
So I think it starts with the work that we put in prior to the fall season. And it was a collaborative effort with the three of you in this room, along with Dr. Stern and Tim McDonald from Public Health, as well as the other athletic directors and administrators within the Bay State Conference, putting together guidelines and safety protocols that made playing athletics safe, and a commitment amongst not only everyone within the Needham Public Schools, but also the other schools and teams that we play, that we're all following those same guidelines. And just to echo what Barbara and Aaron said, we had a very successful fall season, and we based that success on that we were able to complete it without any major issues. And that is really because of the effort put in not only by the coaches and the players, but the parents and the families for following the guidelines and the protocols to make that season happen. And that was something that Mr. Jackson and I met with the team captains across all sports at the beginning of the year to talk about their responsibility, not only in their season, but for the entire school year. It doesn't matter if you're a fall athlete or you're a spring athlete. If you're a spring athlete and your actions out of school cause the school to close down, that's not going to bear well for you to have your season coming up. So as Barbara said, it was a combination of people not only following the protocols and the guidelines on the field, but people changing their mindset. And a big part of being able to run athletics is athletes and families changing their mindset and their priorities and their habits, not only on the field, but in a given year, you'll see kids who they have the sniffles. Well, I got to practice, or I got a big game tomorrow. I'll tough it out. I'll go. And it really starts with the coaches emphasizing, if you're not feeling well, similar to not coming to school, don't come to practice. It's better that you miss a practice or two than to show up and then shut your whole team down.
Right.
And as we move into the winter season, obviously there's a greater concern with the numbers going up and the sports going outside to inside.
I was just going to say, so the fall season was successful on many levels. It was, students competed in pods, so they weren't playing across the state. Their tournaments were generally canceled. But now we're indoors, and I think we're all concerned about that.
Right.
How do we, first of all, what teams are we thinking about fielding? And then secondly, did you have some of the same conversations around health protocols as you did in the fall? So,
absolutely. So the sports that we are looking to run, it's a combination of what was allowed by the EEA, which is providing protocols and modifications for all amateur and youth sports. Then the MIAA Sport Medicine Committee weighs in on what sports can be played safely. So sports like wrestling, which was not deemed safe to play in the winter season, has been moved to the spring. indoor track and field, we use Reggie Lewis Center. They're not open to the public, so the team didn't have anywhere to run. So we pushed that to the fall 2 season. But the sports that we are moving forward with are swimming and diving, basketball, ice hockey, gymnastics, and alpine ski, all with heavy modifications. And so as athletic directors and administrators within the Bay State Conference, we've taken those modifications and then where we felt necessary, added even more strict modifications to ensure the health and safety of the student athletes, which is going to be always our number one priority. And I think, as you talked about the pods, we have a lot of like-minded administrators within the schools in our league that's their number one priority. And so we'll play the same team home and away each week for potential contact tracing, which, as we talked about in the fall, that luckily that didn't have to come up. And as we saw that shown that there was not transmission in the schools, I think any cases that we had within athletics were from outside of our program. So it may have been an athlete that had to quarantine or an athlete that had a positive case, but it wasn't from playing Needham High School athletics. And I think we use that as the basis for all of our protocols for the winter. So I think as we talk about the indoor sports, the guidelines are even more strict than they were in the fall.
You said something a moment ago. You had involved our school physician, Alan Stern, Tim McDonald, the town's director of public health and human services. Barbara, of course, is involved, and Aaron, in talking through those protocols. Let's get real specific here. Basketball, for example. I'm
Sure.
trying to think. I think about maybe a Newton North game in our gym, which probably isn't going to happen this year in the way that...
Yeah, if I can say real quickly, I mean, Dan can articulate even more fully the changes to the rules and the impact on the athletes in order to be able to provide the season. One thing that we need to highlight as well is there's an impact on fans. In an outdoor space like on Memorial Field, if a parent was off to the side, that was possible. They could be very distant from others. Indoors, we can't have that. So for the fans, this is going to be a different season as well because they're not going to be physically present for those games.
So no spectators in the gym.
Correct.
Or in the hockey arena.
We fully recognize, we're parents of athletes. We recognize the impact for those parents, particularly for seniors. Yeah. And yet our goal is to provide the opportunity for students in as safe a way as possible. And so that does mean limiting and making sure that there's no other fans in that arena. So I know a lot of protocols that make people uncomfortable and go beyond what some may prefer. But again, our goal here, our effort, is to make sure that these are happening safely, period.
So talk just a little bit about those protocols, and we'll use basketball as an example. So you
Sure.
have this gym, the Needham High School gym, with bleachers on one side, no spectators, just the two teams and some officials. That's essentially it inside the gym,
More or less, yeah.
and the athletic director. So what about is the bench crowded? Are they wearing face masks? What are the rules? Talk to us a little bit about what that might look like.
Right. So the difference between these winter sports and a sport like soccer or field hockey in the fall is for hockey and basketball, which we're talking about, masks have to be on the entire time. Now, in the fall, if you were 10 feet away from an opponent and you were outside, you could pull it down to catch your breath. That's not allowed inside. For the benches, all seats will be spread out 6 feet apart. And so for our gym, since we won't have spectators, our plan will be to have the home and away teams in the bleachers spaced out. So 6, go up a couple rows, 6 more, and that's where the players and coaches will be. And so a big part of being able to run a successful program in the winter is not so much the modifications of the game itself, it's everything else that surrounds it. And that's what we've been trying to stress to our coaches and what we talked to all of our athletes last night as they started tryouts and practice. There's no access to locker rooms. Kids will show up ready to play. We have protocols in terms of entering the A gym from the doors by the B gym, and then you leave by the tennis courts. You don't show up until 15 minutes prior to your set practice time or game time. We have protocols in place for when we play games. So when visiting teams show up, same thing. Don't show up prior to this time. Enter through the tennis courts. So we have designated areas for mask breaks during games. So it's everything else that surrounds the game itself. The modifications to the game itself, the players and the coaches will adapt to that, and they'll get used to it as they did in the fall. But what we're really stressing this year is everything else that surrounds the game. And what we told the kids last night is there's going to be a severe emphasis on masks. And as I talked about the Bay State Conference adding in additional measures, we've added in rules that the first time an official has to ask you to pull up your mask, it's a warning. The second time, it's a technical foul. In hockey, first time is a warning. The second time, it's a 10-minute misconduct. So if the kids aren't following these protocols,
It'll impact the team.
It's really going to impact the team.
Yeah.
And so that's what we talked to all of our athletes yesterday on the first day of, like, this is our priority. And so everything that surrounds the game is just as important as the game itself.
So, Aaron, I have to ask you, not to put you on the spot, but I'm going to go ahead and do this so we're clear. If our focus, as it has been all year, on health and safety, if you felt as principal and Dan as the athletic director, that a team, whether it's a varsity level team, a JV team, they just can't seem to either on the field or off the field maintain some of those protocols, what's going to happen?
The season ends.
Okay.
We approached the same thing in the fall season where on the second incident of a positive case, the team shuts down. And that includes in the scenarios that Dan talked about where somebody outside of the team is interacting, becomes infected, and brings it into the team environment, and the team would shut down as we had a couple small scenarios in that sort of situation in the fall. That counts. Even though nothing was done wrong amongst that team, second time, the entire season is done for that particular sport. So there's really not any leeway for the students. They need to make sure that they're making great, safe decisions in the school, at home, on the team, involved with the team in every aspect of their life.
Well, I appreciate hearing that. That's severe, but I think absolutely appropriate because the focus is on health and safety. We want to keep students in school for teaching and learning. Athletics and co-curricular activities are part of that experience. However, the focus really has to be on keeping a health and safe classroom experience first, and then everything else. So I appreciate you taking a very hard line on that. I do want to think about, Barbara, in a moment, asking you about travel and how that might relate to any of these teams that go around. But Aaron, first of all, so we have this really robust athletic program that we're thinking about that is really focused on health and safety, and I very much appreciate all the time you're putting into that. What about other co-curricular activities at Needham High School? How else are students being involved in the life of the school?
Yeah, I think starting with co-curriculars, or starting with athletics, is a great place because it is the largest program in the state. I believe we're still in that position. Our co-curriculars mirrors that. We have over 150 different clubs that are active throughout the high school. Incredible investment and involvement from our students. And the vast majority of those clubs can transition into a virtual environment fairly smoothly. Obviously, there's the loss of not having the in-person contact, but the work itself can continue in a virtual setting. And so we've shifted all of our co-curriculars into virtual experiences this year. There are certainly some that have a little bit more difficulty doing that or are clearly limited. You know, the student council isn't able to have the same impact on the building by not doing things in person, for instance. Or a group like robotics is really a very hands-on, active, engaging activity that can't happen in a virtual environment. So just as we've done with sports, where some sports simply aren't running, we're taking that same approach, trying to support all that we can in this environment and acknowledging that some can't right now. The other difference that we have between athletics and co-curriculars is Dan talked about the state organizations that help provide very clear guidance for us that are really informed by medical professionals, scientific professionals, healthcare professionals. We don't have that same parallel in these 150 different individual pockets. So what we are doing with some of those clubs that are more directly impacted by having to go virtual is working individually with the club advisors and any of the organizing bodies that we may be able to lean on in those areas to figure out, is there a way as we continue into the year to help those clubs become more active in person? We're going very slowly, very carefully with this. We are not going to race. Maintaining a stable learning environment day after day, which we've been able to do so far, is the priority. If we can add to it, we're going to continue to look at those areas to do so. And where it doesn't need to be forced, we're not going to. If a club can continue to be virtual, it's going to continue to be virtual from here right through June.
So health and safety is a priority, and also thinking about, as we get into this year, some flexibility that is health and safe would be appropriate. You know, I'm thinking, I know that we have in the Needham Public Schools a wonderful performing arts program. And, you know, I'm thinking about maybe there's some time in the spring or the winter where there's an empty gym and there can be a small concert that's streamed, no spectators, but physically distanced. Maybe that, I'm sure that there would be some, you'd have many students who would be interested in doing something like that. So maybe these are some of the things that we can start thinking about.
Even this past week, you were part of Friends of Music Winterfest. You know, it transitioned. It's a staple of our year, always mid-December. Great fundraiser for Friends of Music, and great opportunity for students to perform. It was a virtual environment this year, and it certainly felt different. There's no doubt about that. And the students were able to perform, and the fundraiser still occurred.
Absolutely.
So those things can still happen in this virtual environment, and we'll continue.
We have all been reinventing some of our work here. Well, as we conclude with this conversation, Barbara, just real quickly on travel, we want to, as we think about the upcoming holidays, we have to tell families again, you have to really modify your travel plans. But if you do travel, remind me and remind us what families have to do if they travel outside the state.
So if you do travel to a non-lower risk state, which today is every state except for Hawaii, you need to provide the school nurse with a negative PCR test that was done within 72 hours of your return back to Massachusetts, or there's a 14-day quarantine requirement. For students who are age 10 and under, if their parent submits a negative PCR molecular test to the school nurse that was done within the 72 hours upon arrival to Massachusetts, then the student under age 10 would not need to submit a test. If the parent does not produce a test, then the student must remain home in quarantine as well. It's important to remember also that if you go away for a weekend, you can't be tested, say, on Friday before you leave, wait for the result, and come back from out of state and use that test result. It has to be a test that was done once you've left the state.
I think what folks have to remember, I know over the holidays and even over the winter, people going away skiing for the weekend or whatever have to follow these rules if we want to keep schools open. And I think that's the key thing. If we want to keep schools open and learning going on and activities to continue, folks are going to have to follow these rules. I will also hasten to add, we've done this already. If we learn that a student did travel and did not quarantine or get a test or follow the protocols, we will send that student home for a period of time for remote learning. That has already happened and that will continue to happen, so I really urge families to make sure that they're paying attention to these tests. Well, I appreciate this conversation. We want to provide a great program for our students, a curricular and co-curricular program. I appreciate your leadership around this, Dan, and Aaron, I know that you're been managing all of this for high school students, and Barbara, your work and the nurses' work to kind of keep us afloat has been extraordinary and heroic, frankly, in so many ways. What the community should understand is that we're very much focused on health and safety. We will continue to make that our priority, even while we're attending to in-person learning. And lastly, as we continue today, one of the things I learned earlier, or that I'm aware of, is that it's your birthday. So in honor of your birthday, I thought I've put this together. I'll ask that you open it. It's on behalf of all of us, that you might find that if you come in handy, if you can pull it out and share with everybody.
So
you just might need this. We're not sure. But
yes, thank you so much.
Happy birthday to you, Barbara, and to everybody in the Needham Public Schools. Thanks for your time today, and I hope everyone has great upcoming holidays.
Thank you. These will be used well.
I'm sure they will.